All right, welcome back. Now, it's November, and you might notice some men looking hairier than usual in the face area. The month earned a new name, Movember, when men are encouraged to grow mustaches to raise awareness on men's health issues such as prostate cancer, testicular cancer, and men's suicide. Well, men often shy away from discussing matters health for reasons we'll hopefully get to know in tonight's topic. According to the World Health Organization, 14,215 men in Kenya die from cancer yearly. Now, the high death rates have been linked to late diagnosis, shame in seeking treatment, low income, or just plain fear of finding out. In men, prostate cancer leads at 2,864 cases. Now, more than 3/4 of all people diagnosed are over the age of 60. Hence why it is viewed as an old man's disease. But does that mean young men wait to be screened? My guests in studio, let me introduce them really quickly. To my far right is James Kibunja. He is a trained lawyer, as well as an advocate for men's health under the Strongman Project. He'll be telling us more about that. We also have Dr. Andrew Odhiambo, oncologist and a lecturer at University of Nairobi. And to my left is Richard Kiundi, who is a cancer warrior. He made sure I put warrior and not survivor. Right. And last but not least is Wachira Gitai. He is the co-founder of Movember Kenya. Gentlemen, thank you so much for joining me. Let me begin with you, Dr. Odhiambo. The different kinds of cancers that we are likely to find in men, what are they?
First, thanks so much for inviting me to be here and to shed some light on cancers in men. So in Kenya, probably the top 5 cancers in men would be prostate cancer would be number 1. We're seeing a lot more of esophageal cancer, which is the cancer that affects the swallowing tube. We're seeing a lot more of colon cancer. We're seeing a lot more of stomach cancer, cancer of the liver, and this very rare group of cancers we call lymphoma, which affect the blood system. But by far and large, I think prostate cancer and esophageal cancer takes up a bigger burden of the cancers in men that we see in Kenya.
Okay, and of course, I know more of tonight's conversation will be on prostate cancer.
Yeah.
But Richard, you actually went through stomach cancer. What was your experience like from the point of finding out that you actually had it and the treatment process?
Well, I had stomach cancer, first of all, and the discovery was not as straightforward as you'd imagine, because, you know, I had discomfort in the stomach, and I would go to the local clinic just around where I live, and I'd get some medication for something. Sometimes it was bacteria, sometimes next time it was typhoid, then it was H. pylori, then I don't know what. And I was quite comfortable to keep on going back, you know, time in, time out, until my wife stepped in and said, look, you have to get proper diagnosis. So that's when I went to a gastroenterologist. Is that how you pronounce it?
We have to ask the doctor here.
Gastroenterologist, who are specialists who deal with the intestine.
Exactly. Yeah. So we said that now we must go and get somebody who's really going to look at that stomach properly, or why you're having problems. So I ended up with a gastroenterologist, and I did a colonoscopy and endoscopy. I didn't even know they're different. I thought it was just one thing. So I did the two, and when the results came out, there was a tumor. They took out some samples, to the lab, and it came out that I had cancer. This was just where the stomach becomes the large intestine.
What stage was it?
Fortunately, it was 1B.
Okay. And
the doctor told me that that is the luckiest thing she thinks has ever happened. They don't find them that early.
Wow.
Yes, it was just... So sometimes I think if my wife wasn't curly, I would still be... Okay, not curly as such, but she insisted, you know.
No, she was keen, to ensure.
Yeah, she insisted you must go and get this, you know, we must know what is going on.
Right.
Yeah, because this repeated thing. And then, of course, now the treatment started. I had immediate surgery. And then after that, of course, now I went to see the oncologist. And I heard of something called PET CT scan at that point. I'd never heard of it. I had to undergo this, which was only found either in India or Egypt or South Africa or US, you know.
Yeah.
But price-wise, cost-wise, the most affordable is India. So off I went to India, did the PET, and they gave a proposed course of treatment. which I came with back to the oncologist, and of course we looked at it, and I couldn't afford it. So back to India, where it is cheaper. So I went to India, I did 3 months chemo and radiotherapy, sometimes concurrent. Did 25 radio, and I was supposed to do 6 chemo, but the 25 radio ended at the same time as the 3rd chemo. So I bought the drugs and came with him. So now the last 3 I did at Mpisha. I did locally.
And of course, we'll talk about now life after, once you've beaten it. Wachira, you started Movember Kenya 7 years ago now. Yes. And I'm sure you've heard a lot of interesting stories from men in terms of what they think health looks like. We've heard from Richard, you know, you just go to the clinic, get what you need, fix it, you're good to go. Yes. But, you know, for the average Kenyan guy, what does health look like? At least from your interactions with different guys.
First, I'll start by saying that as men, we grew up with a cultural niche where we are supposed to be strong, we're supposed to be able to take care of ourselves, we shouldn't complain. Certain words emphasize like man up or be a man all the time. So when you're in a bit of pain, you have an issue, it's hard for us to like come out and say it's an issue. As he has said that he wasn't too keen about it. He just got a few drugs, came back, but his wife pushed him. And as you can see that if we were not stubborn, it's also a thing, I think it's masculinity. It's not about our ego, an ego thing. I think that's our masculinity, that we want to be seen strong. We can hold our own all the time. So for us, rushing now to see a doctor will be now a problem. Yeah.
And you can see how that is a big problem in terms of where do men go then to be able to talk about their health issues, for instance. Where are the safe spaces? And James, Strongman Project, you're trying to at least create that for men.
Yes. Essentially, as Wachira has said, we try to brave it off as men. We don't want to go for treatment or checkups. That's why we've initiated the Strongman Project. So what we'll do essentially is tour around churches or corporates and try and encourage them. We teach them on health, personal grooming as men, and also just checking yourself. Because sometimes you are so focused on providing for the family or for yourself or for the people around, you don't actually take care of yourself. So that's where Strongman Project comes in. Yeah.
And let's hear from the doctor now in terms of prostate. A lot of interest around this particular cancer for obvious reasons when it comes to men. But I find it becomes such a buzzword that people don't even know what a prostate is. So what is it? What are its functions? So people understand, okay, why does it become a problem for men later on?
So maybe I'll start by saying the prostate gland, it's a sexual organ. It's found in men only, and it sits just beneath the opening of the bladder, where the bladder connects to the urethra. So the prostate gland has many functions, hormonal functions, but it produces some of the fluids that come out during ejaculation, and it helps to make the sperms, you know, migrate with ease, as it should be. So that's usually the main function of the prostate gland. Now, usually when you grow old, when men grow old, then it begins to swell, and sometimes it causes a blockage of urine coming out through the bladder, which is a very common problem, which is not usually cancer. But then at the same time, growing older predisposes one to getting prostate cancer. So the symptoms might be, you know, confused to be one of just the ordinary swelling or prostate cancer in itself. So we urge men, if you have any problems going to the toilet, either you're going too soon, or the dribbling is too much, or maybe it's coming out in your panties, or you're having blood in urine, any symptoms that, you know, are distressing you when you go to the toilet, maybe you're waking up too many times at night, then you have to go and get checked. It might not be cancer, or it might be, but you shouldn't ignore those symptoms and just sit and think that it could be maybe an infection or anything. So you really have to go and be checked by your urologist so that we can determine whether there is cancer in the prostate or not.
You mentioned the word checked. And I remember when I was mentioning this to a lot of my male colleagues that we're going to have a discussion about prostate cancer, and they said, please ask the doctor about how do you get checked, because some of the screening is invasive. And a lot of men think, I don't want to go through that, you know.
it's very simple, first of all. One thing I must say is for prostate cancer, it is still not well established that there's a role for massive screening, and by that I mean, just going into the church and saying, just make a line here, then we take your blood and we check for prostate cancer. No, you have to be an informed patient, an informed man, So if you're well informed about the test and you fall in within the age bracket of men who benefit, so if you're below 40, and if you're above 75, you probably have no benefit from screening. It is those men who are limited within those ages of about 40 to 75. And then we start looking at, do you have prostate cancer in your family? Are you black-skinned, or are you Caucasian or white? And then we divide you into various categories. Then once you've understood the pros and cons of doing the blood test, which we call PSA, which is prostate-specific antigen, once you understand the pros and cons of the test, then you can actually be subjected to the test. The reason I say this is because this is one of the screening tests that actually can bring harm instead of benefit. I'll give you an example of a patient I saw about 2 weeks ago. 75-year-old man, very keen, with his health. He lost his wife to breast cancer, and so he was caught up in the whole October thing about getting checked. So he went. He did a PSA test. It was abnormal, and then he took that test now to the doctor without having been informed prior.
Right.
So you cannot ignore the result. He went for a biopsy, which can be very invasive. It can have complications, bleeding, being in hospital. And then we diagnosed him with a very mild form of prostate cancer, which would have otherwise never manifested, and you would have never known, and probably he would have succumbed to other reasons.
Right.
But now that it's there, he has to be treated. The drugs cause sexual dysfunction. They're expensive. So he was sent into a turmoil of things that he probably didn't need to. So you must understand, with your doctor, pros and cons, and then if you understand that, then you can get tested, and then if your test is abnormal, then you can see the urologist for further treatment.
I mean, it's interesting because you'd think you're doing the right thing by going to get tested, not thinking that, wait, this actually could further jeopardize my health if I didn't have the right information. For you, Richard, now that you're on the other side of this, what are some of the steps, the measures that you've taken to ensure you're healthier, you know what's going on in your body?
Actually, maybe I might just say something about the prostate cancer test. I've only done it once, other than the one with the PET in India, but now here locally. There was this young lady, I was doing something for insurance, and there was this young lady doctor who wanted to check the size of my prostate. And I mean, it's very embarrassing. On a very serious note, if I'm told to do it again, I'll say no. So I don't want to explain.
No, but thank you for being honest, yes.
Yes, I wouldn't want to say exactly what happens, but I think Dr. knows, So, and most men, then, it becomes a long story that men are talking about, when you go there, this is what's going to happen to you. And so a lot of them I'd rather not go. And then the other thing is, okay, for me, for example, since I've been, as you say, I'm on the other side, I've taken steps to have a healthier life. I've checked my diet. There are a lot of things that I don't eat anymore, but I do a lot of exercise. So, and basically, I get checked every 6 months now. That's a must, because I do not. But the one thing is, I had that cancer about 5 years ago. So I've been doing the PET every year up to this year. I did the last one in August, 5 years. So the guys told me, now you are clear, your cancer is cleared, you're okay. You don't have to come back. But other issues, I'm hypertensive, I'm diabetic, so I'm on medication, I'm on a specific diet, which I don't want to play around with, because I was there and I don't want to go back there. But talking with other men, it's one of those things that you find, the man is supposed to be the rock. We were brought up that even when we were kids, don't be a sissy, don't be I don't know what. So that completely messes up the cycle of growing children, that you should be able to suffer, We are told the story of some guy who had I don't know what it was, but his stomach had been ripped off by some, it's one of those hero stories. Had been ripped off by some lion, and he put his shirt together, whatever it was, and walked home, which is definitely impossible. So we set such high standards. No, seriously, we set such high standards for our boys that we completely mess them up. So this is the guy who's not supposed to feel pain, he's not supposed to get unwell, he's supposed to be the guy everybody looks up to, So basically the guy just dies when he's walking.
Right.
Yeah, most unfortunately. But for me, I'm past that. Let's put it that way. I was beaten. I'm twice shy. And I have one son. We talk a lot. I had two, but I lost one. So we talk a lot about, you know, what's going on and what it means being a man. He's now a grown-up. I go to see my grandchildren once in a while. And so we talk a lot about, you know, what you need to watch out for in the early 30s and as you grow up. And the fact that I'm diabetic and hypertensive, same thing with my mother, my two sisters, my one brother. So it generally runs in the family.
Wow.
Yes, so this is one conversation that I have, and I tell him not to be the man. I mean, in that, I think that's negative. Being a man does not mean that you don't feel pain. Being a man does not mean that you don't get hurt. Being a man does not mean that you're not... You know, men are socialized to think they are immortal.
True.
Yes, they will never die.
Yeah.
You know, you're just there. Or if you die, it will just be one day. You know, nothing, you don't go down. You just... you know, crumble that one day and become dust or something like that, which is, you know, I think we need to, and I'm glad that these two gentlemen are working into this to try to change the perception of men. We are human. We all have the same foibles like everybody else. We need to be taken care of. We need to take care of our bodies. I think it is very, very important that that information, that kind of thing must come and change. That I must be a good friend to my oncologist. I must be a good friend to my dietitian. I must be a good friend to my cardiologist. So that, because I have systems that will fail.
Yeah, exactly.
And when they fail, you don't know. What causes the failure, you have no idea. It's something maybe you are born with. It's something maybe you ate a long time ago. But we need to be aware that we're just human.
And I'm glad you mentioned that, because that, you know, often leads to that toxic masculinity that we see that has a negative impact on men mentally. You know, I was so shocked to see numbers of suicide rates 3 times higher among men than women. You know, and I know Movember is very, very keen about talking about mental health during this time. What do you tell men during this time when it comes to the mental health?
As Movember, ours is to try and get people to check up on their friends, because a man won't just see this is going on in their lives. They're going through a dark time. Just give a call to your friend, find out if he's okay, how you're doing, how's your day going. We've seen that approach has actually made men talk a lot, open up about what they're going through, if it's financial issues, substance abuse, or any other reason that may cause suicidal thoughts into their lives. Just to reach out, find out if they're okay. Mental health, especially amongst men, is somewhat like a taboo for even to speak about that. I'm not feeling myself, I'm moody, I'm not happy, I just feel tired of whatever is going on in my life. But as we've said, we have been brought up as being the people to be seen that they are strong, shouldn't show any signs of weakness. And yet we have a lot of chinks in our armor, to be honest. As you said, the numbers are high. Could see, just the other day, someone in a big job actually committing suicide the other day. So you are shocked, he has everything. Why did this happen? Right. So we are just trying to reach out, find out if your friend is doing well. Just give them a call. It's as simple as that. Give them a call. It could be the day they actually open up.
Right.
Yeah.
And, you know, James, when it comes to now getting more men into the doctor's room, for good reasons, not because something is wrong, how do we begin to do that? Because even when I was doing my own Google search, if you will, for are there men's clinics or even men's hospitals? We have a women's hospital, we have children's hospitals, but there isn't one that's directed to men where they feel if I walk in, I'll get what I need. And I wouldn't feel like it's a strange experience. True. It will be something that's catering to me.
Yes. So that's basically, that's the gap we want to fill as Strongman project. It said that most of the deals are signed in pubs. You know, when men meet, they discuss, an idea starts from Washira, goes round. By the time it gets to James, it's a done deal. We've set deadlines for Monday, then Tuesday we'll register, you know, so on, so forth and so on. So Strongman project is where now we gather the men together through events. We want to launch on the 29th, that's this coming week, and that now will not center our discussions only in November, it's across the year. You know, now when men gather, we can bring them together and tell them, hey, you know, We have Daktari today. He's going to be speaking about prostate cancer. Daktari can link us to someone else who know about mental issues. So in the next event, there is mental issues. So as they keep getting informed, they keep now opening up. Because at this event, you'll see, maybe I'll not go for the prostate one, but the mental issues one, I'll definitely attend.
Right.
So now that's creating that pool where we can meet as men. As much as we're enjoying ourselves, we can also get and garner information from the people there.
All right, and let me wrap up with Daktari here. Andrew, you know, in terms of, you mentioned we have to be careful when it comes to the prostate screenings, but I mean, generally you need to go for screenings for different kinds of cancers or, you know, different kinds of conditions. What would you recommend for men now that are watching? What should they be looking out for?
Okay, I think let me first emphasize on issues that you can change. You know, prostate cancer, we know it's common as you grow older. If your race is black, you know, and sometimes if you've got family history or genetics in your family, which you can't do anything about. But the few things you can do something about is your diet. Diet that is rich in fruits and vegetables and that is low in fat has been shown to reduce your risk of prostate cancer. Exercise and keep your BMI low. In fact, I'm just from presenting in an obesity conference at the Nairobi Hospital, and we're talking about the bad effects of obesity, and one of them is contributing to many cancers, not just prostate, breast cancer, cancer of the womb, cancer of the pancreas, cancer of the lung. So you really need to keep your weight low. It will go a long way in terms of preventing you from getting many other cancers. And then you have to exercise. The benefits of exercise go beyond just weight loss, because you change the whole way your body works and the metabolism, so that your levels of inflammation can go low, and then you can prevent yourself from getting these cancers. And then if you're between the ages of 40 and maybe 70 or 75, visit the hospital, talk to a doctor about the pros and cons of doing a prostate screening test. You might be given something to go and read at home, do your own research. You know, it's the internet world now. You have a phone, Google about it, read about it. Once you've understood, then you can be offered the test. And then if the test is normal, you can get checked after 2 years. If the test is abnormal, then you have to be sent to the urologist. Remember, the PSA test that we do in blood, if it's negative, it doesn't mean that you do not have prostate cancer. You could have prostate cancer with a normal blood test for PSA, and you could have an abnormal PSA test and you don't have cancer. You get the point? So you can't do it blindly, because sometimes the results can make you not sleep. You know, I've had sometimes patients call me, you know, even Saturday or Sunday, like, I did this test, it's abnormal, what do I do? I can't sleep, I can't do anything. Then when you come to the office and we check, we find out that actually you don't have anything wrong. So that's the advice I would give to the men out there. And one thing that he said that's very important is, and especially with regard to stomach cancer, and allow me to say this, is if you're being treated for a condition repeatedly, whether it's amoebiasis, typhoid, I don't know what, tuberculosis, pneumonia, anything, please make sure you get a second opinion, because cancer as it is, some of the cancers will just present like normal ailments. You know, stomach cancer will always just present like you have acidity or heartburn, and the doctor who is seeing you will not know the difference between the two. It is the repeated nature of going to the same hospital again and again that should ring a bell, and especially if you're aged over 50. You know, if you're taking acid drugs for a whole month, then there's something really wrong. You need to go to your gastro, you be checked so that we can find these tumors early. It's so sad that most of the gastric cancers we see already will be stage 4 disease because of hopping from one hospital to the next. And you know, something that's very weird is that when you find an explanation for something, then you're at ease. You know, you'll go and then you'll be told you have H. pylori. You might have it, but something else could be sitting underneath, which is more dangerous. So the fact that you find a problem or a reason for your problems, it doesn't mean that something else couldn't be there. if things keep getting tested and they are positive all the time, it's the same thing, just go get a second opinion and make sure that you're checked so that nothing is wrong with you.
Okay, great. Great advice. Thank you so much, gentlemen, for joining me. And a quick one, where can men find you, Wachira and James? First with Movember Kenya.
You can find us on social media mainly. I think that's the best place to reach people. So it's at Movember KE. That's for Facebook, that's for Instagram, that's for Twitter. Also, you could get us, email us on movemberke@gmail.com.
Great.
Yes.
We are... okay.
Oh, look at that, yeah.
We are also online. Strongman Project on Instagram and Strongman Project 1 on Twitter. We have a launch on the 29th at the Meta, Nairobi. That's along Riverside. Well, Daktari will invite you, of course, just to discuss the way forward and also to plan for the whole year. That's 2019.
Okay, great. Thank you once again, gentlemen, for your time, for your insights. Richard, do you have something you want to say before we close?
We are done?
We are done. Can you imagine?
But we've hardly scratched this subject.
Exactly. And you know, the whole point of having such forums is what James and Wachira have, to really hash out a lot of these issues, because you can't exhaust it.
Okay. Can I just point something about what Wachira said about calling your friend? We've started a movement with every friends of mine that you look at your phone and the numbers that you have not called for a while, you just call them. Say, how are you doing? You know, just a call, nothing. If you find that there are people you have not called for a while, please delete them, because it means they're not your friends. It means you don't care. But the minute people start realizing that, you know, you care, you just want to know how they are doing, then they will open up to you. So for you, I have your number on my phone, so I'll keep on calling you.
I'll be waiting. I'll be waiting, Richard. Thank you so much. Thank you for your time, and hopefully these conversations go on beyond what we've discussed here in the studio. Safe spaces are out there, so there's no excuse for men out there to talk about their health issues and to get healthier, not for themselves, but family and for society as well. Thanks for watching. I'll see you again tomorrow night on Sunday Live with Jeff Koinange. Good night.